Stroma. Okay, got it. Stroma. Okay, stroma is also covered. So supporting connective tissue, the basic architecture. Okay, and you are saying the fats and the gland. So it means everything you are saying. Now you are left with ducts and glands. So what do you think? Ducts, not the glands. Okay, good choice. Okay, out of 4 which I have given, you have chosen 3 things. You say, okay, fats, ducts, and stroma. Okay, now bit tarteeb, I am changing that. Okay, now look at the order. The most important thing which it is developing is the basic architecture, basic design, support of the breast. So number 1 will be stroma. After that, you are developing the secretory portions which are conveying the materials. Those portions which are causing the pathways for the secretions. What are these things? Ducts. Okay, and finally, to develop the shape of the breast completely, what are you doing? Fat. Okay, so this is the tarteeb: stroma, ducts, and fats. Okay, this is the action. Okay, it means estrogens are giving shape to the breast. Okay, they prime the breast. The initial shape of the breast, taqriban whole shape of breast, is developed by estrogen. Progesterone is also doing a little only the glandular structure, the final part. The rest of the job is done by the estrogen. Okay, so the main hormone for the breast shape, for the breast development, for the breast contour is estrogen. Please remember. Okay, estrogen's action on the
softness of the voice.
Okay, it will not really change the larynx, it will not change the voice structures, just like males. Okay, what happens in males is different thing. Okay, we change. What do you think about the skin? Yes. Okay, it will cause the softness of the skin. It will increase the vascularity of the skin, blood flow of the skin. Okay, it increases the blood flow of the skin. It improves the healing of the skin. If you increase the blood flow in one area, what will happen to the healing? Better healing, really, isn't it? Why is the blood flow increased? By slight vasodilation. All right, vasodilation. Yani, if the vasodilation is there, the skin will be warmer or colder. Okay, females have a slightly warm skin, thin skin, thin. Okay, they have delicate skin, and they have soft skin, and they have slightly more vascular skin. The vascularity is a little more. Vasodilation is produced by a non-genomic action. Remember, I used the word non-genomic action. It means a quick action or a slow action. It's a quick action. Okay, so the skin actions are probably the non-genomic action or the cell membrane actions. Okay, they make some changes in the skin, which is typical. So that's why female skin is better in texture, and our skin is rough really. Our skin becomes darker easily, more pigmented, more dark because of the testosterone hormone. It is more thick. Okay, but female skin is comparatively more delicate really, and soft and warm. Okay, and more vascular. These are the properties of the non-genomic actions which is happening. Okay. Estrogens have a very special effect on the feedback effect on the hypothalamus and pituitary, a negative feedback effect for the control in the ovulation process. I am not doing that right now. Just remember one word of mine. Tomorrow, inshallah, we'll do that. Okay. Estrogen has a negative feedback effect, and estrogen also have a positive feedback effect, a very special double effect that we'll talk about. But that should come tomorrow in the ovarian cycle when we talk about that. Okay. So these are the actions of the estrogen. Estrogens are beauty hormones in the sense that they are called cardioprotective or the vasculoprotective hormones. Look at my word, please. Okay, listen to it carefully. Cardioprotective and vasculoprotective. Okay, they cause vasodilation, relaxation and vasodilation. So what do? Improve the blood flow. If there is vasodilation in the heart and increased blood flow, are there more chances of heart attacks or damage or less chances? Less chances. Okay, so Estrogens are very special hormones because they protect the females from heart attacks. Usually females don't have heart attacks before menopause. After menopause, yes, they become like males. But before, no. Hardly you will hear about any female at the age of 25 or 30 years, 35 years having a heart attack. Males can have it even before that time, 30, 35, 40 years also. But females don't have it, usually before menopause. Estrogens are cardioprotective and vasculoprotective. They protect, and these actions on the blood vessels are probably genomic or non-genomic. What do you think? They are mainly the non-genomic actions. This is what we have known about them, the cardioprotective effects. And estrogens probably also have some protection in the form of decreasing free radicals in the cells also. And this action is also a non-genomic action which is thought. Okay?
It's also increase high density lipoprotein. Increase high density lipoprotein or good cholesterol.
Yes, okay, definitely. Now we are coming to the metabolic aspect, just your thing which you have mentioned. Now coming on the fat metabolism or the fat metabolism. What is the effect? Well, fat distribution, one thing that we have done. Second thing is that in the blood, it decreases the low density lipoproteins, and it tries to increase the HDL or the high density lipoprotein. It changes the ratio between high density lipoproteins and low density lipoproteins, which means it decreases the cholesterol overall or increases the cholesterol? Decreases. It is one of the very few hormones of the body, Shabab, that decrease the cholesterol. One hormone is estrogen. What would be the other hormone which can decrease? Lovely, lovely. MashaAllah, you have done endocrinology. So remember in your list, in your register, memory register, that there are two very important hormones, thyroid hormones, anti-cholesterol in nature, estrogen, anti-cholesterol. All others are not really, okay? They are pro-cholesterol or may be having no effect on cholesterol. So estrogens and thyroid hormones too, please. Anti-cholesterol. Anti-cholesterol nature, vasculoprotective and cardioprotective effects. If you combine those two effects, the females are safe from the heart attacks or the heart diseases usually before menopause. Before menopause. After menopause, just like us, anytime, equal. Okay? So what are one of the most serious dangers of the menopause? After menopause, what can female have? Osteoporosis, number one, bone damage. And second thing is two things. Okay, great. All right? Yeah. Yeah? It has many minor roles. It has many minor roles which we haven't discussed. It does have a stimulation effect, and it overall improves the defense system, because when there is low estrogen state in the body, then the females are prone to more infections, especially the genital tract infections become very common in that female. Okay? All right. I'm keeping some of the actions of estrogen especially for the purpose of the pregnancy discussion, okay, or for the discussion of the delivery or the labor process, which we'll have later, inshallah, the lectures coming. So I've only introduced you to the main actions of estrogen before fetal life and before Wilada. What actions? We have not discussed that. We have discussed the actions in the pubertal life or the reproductive life or the years. What is the function? Okay. All right. I'll keep these actions for the pregnancy issue again. All right. All these actions are for the. All right. I'm just leaving these actions. Let's talk about the progesterone very quickly. Okay. Yes.
What about the psychology effect?
Yes. Good idea. Okay. Let us discuss. Abdurrahman's point is that what is the effect on psychology? All right. Okay, let's discuss it right now. The female is developing as a female, a normal female when developing and passing through. Definitely what happens is that she develops a normal sexual psychology, and an attraction in the opposite sex. Just like we have an attraction for the female sex, the females have the attraction for the males, definitely. It is the rule of nature, all right? Now, is it really affected by estrogen or no? This is the question. Well, yes. Estrogen starts acting on the limbic system, okay, or the emotional system, which is controlling our psychology and behavior, the sexual behavior also, the sexual psychology, in the development phase. And estrogens, they have a special effect called the male attraction effect. But this effect is not coming alone. The most important point is that this action, if only estrogen is موجود, the female will not have an attraction towards the male. Okay? The sexual desire, the libido or overall attraction is decreased very much if only estrogen is موجود and the other hormone is not موجود. The question is, which other hormone I am talking about? No. Yes, androgens. Okay? Well, females also have some androgens, adrenal androgens موجود. It means a combination of androgens and estrogen is needed for the proper development and sexual maturity in terms of psychology. So, psychological implications, you need androgens actually for attraction towards the opposite sex, but along with androgens, you need a background of estrogen. If estrogens are not موجود, if estrogens are yeah, the female will not develop attraction. Okay? If androgens are not موجود, females will not develop attraction. If female hormones and estrogen is موجود, androgen is not موجود, no response at all. Okay? Very confusing response. If androgens are موجود and estrogen is absent, opposite, okay, still a very low libido or almost no sexual desire. It means it's combination. They are essential, supporting each other, synergistic effect. One will not do the job. Okay, you need a background. You need both actually for that. Research is going on. We are not very clear about in humans how much androgen is needed, how much estrogen is needed, but both are required for that. Okay, for